Rocky, Mama's gonna have you move, Boo-Boo.
Okay, it's on. Here, Rocky. Move, puppy. Move, Papa. Come on, come on.
Come on, Boo-Boo. You can sit up there, you just gotta
Here.
sit in the other seat.
Come here, Boo-Boo.
Listen to Mama, Mama's gonna
Come
help
here.
you out.
Yeah, come up here. Alrighty. Come up here. Come up here. Alright, Gabriel, we're recording.
I went to the restroom.
Just letting you know. Okay. So, let's talk about our trip to Florida and back.
Okay, that was good. That's one of my subject matters I was thinking about.
Okay.
You want me to start?
Yeah.
Okay. So our trip to Florida 2 weeks ago, I think it was very productive
Okay.
in the respects that you were able to get some benefit out of it through the administration of a different process and procedure than what you've experienced before with healing having been post-operative. I think you sound better. I know it's still a struggle. 'Cause
Sure.
I know the weather and the environment has a lot to do with that. But I think through that 2 week period, it's definitely been beneficial for what you were experiencing with your breathing problems, or however you want to say what that is, right? Like it's a condition that isn't unfortunately going to go away. And I think it would be good after the new year that we would go down there again
Yeah.
and do that.
Okay.
Like it would,
Did you understand what that procedure was? Did she explain that to you when we were down there?
so this is my interpretation,
Sure.
because it was very brief.
Sure.
So the application will assist in healing the parts of your body or what has been damaged with Tagresso and post-surgical operation to help them begin or at least induce a healing element to where it'll help reduce the amount of struggle that you have with the breathing component of your recovery.
Okay.
That's the best way that I can describe that. How long that lasts or how often it needs to be administered, I think, is subject to how well your body is receptive to that and then the effects of that through that process, right?
Sure.
So that could be in another 3 months or it could be in 6 months, depending on how long that benefit and
Right.
what you know what I mean?
Yeah. How did it make you feel being there that we were going to be doing that?
I'm absolutely supportive of it.
Yeah, but like, did you feel like hopeful that this was going to make a change, or?
I trust in her as an individual and as a medical provider, and I think it's a different course and path than anything that we've been presented, because I feel like we've ended our road with everything that you've experienced.
So tell me a little bit about the road that we've been going through and experiencing.
So based off of the type of cancer it is that you have and some of your personal dynamics with your biomarkers, there's a limited or only one course of action that can be administered. And so they've done that. And Tagresso was not a good choice for you, unfortunately, right? Like, you got sicker and sicker and sicker on that post-operative lobectomy than you were post-operative lobectomy without taking it. And that's the only thing they can offer.
Right.
And so the options are you don't do anything, which isn't going to improve the situation, or you seek out an alternative solution,
Right.
and that's what we chose to do through
Right.
someone who I think is very trustworthy, which is important, right?
Yeah.
Like
Sure. Absolutely.
you don't want to.
Right. You don't want to go to any other, like, any quacks that you don't know. Well, in her case,
Well,
I know who she is, and she's a very medical sound person.
All I'm saying is that it's different than going from Norton's to the James Brown Cancer Center.
Yeah. That was our only other option.
Or another, because they're going to present the same thing if that's the
Mhm.
only option.
I know.
So you have to take charge as an individual, and there's going to be a point to where you have to saying I have to seek out other viable resolutions or treatments or however you want to put that together, right? And see what happens, because it's all trial and error, because it's all science, right? Like it's not,
Right.
nothing is definitive,
No.
because you have someone in your group that had the same surgery, the same post-operative treatment plan, didn't have any issues,
Mm-hmm.
and then it nearly killed you, right? So it's all subjective, and that's why it's science, right? Like it's just the part of.
Do you feel the doctors could have done something differently?
I don't say differently. I think that early on when we asked if there was any other viable way of treating what you have post-operative, that they could have suggested that there wasn't, instead of just saying that, instead of just presenting this. I mean, if they're expecting us to figure it out, I figured it out pretty early.
Mm-hmm.
But it needs to come from them. It needs to come from them and say we can't do anymore.
Right.
And that never really happened.
No. And I don't think they ever really got to that point, did they?
Well, I think our last visit to the oncologist, they said you can seek out a second opinion. I mean, that's them saying that. That's how they have to say that professionally. Right? So that's what we did. So, but that should have happened months before that.
You think?
Yeah, I do.
Why?
I think it would have prevented, it would have lessened the amount of detrimental health effects that you had early on with the Tagrisso. Like, seeing that early on should have been a marker in the respects that this isn't going to work, right? Like, so just for example, right, like if you cut yourself and you pour salt on it, it's going to hurt, right? I mean, you can still keep pouring more salt on it till it cakes up, but it's still going to hurt, right?
Yeah.
But that's not necessarily a viable option for healing. I mean, they should have, I don't know. Maybe they have limitations in what they can say. I don't.
Well, they did offer, like, they lowered the dosage, remember?
Yeah, I remember.
And I was able to tolerate it a little bit longer.
I mean, is it, so with the lower dose, is it really as effective as what it is at the higher dose? Nobody knows, right?
Nobody knows.
Maybe it should have been a lower dose to begin with.
Well, we didn't know then either.
Exactly.
I mean, according to what we researched, and we spoke to people, remember?
I know.
That had done it, and they were successful and didn't have any complications.
I know.
It was just me. It was my body.
I know.
What frustrations did you have during this whole thing? I mean, it looks like, there was a lot of frustrations with the doctors. I think they tried their best, but I think they're tied with insurance.
Yeah, I get that.
But you felt differently at some stages.
I think it goes back to the very beginning when you have two different people in two different medical perspectives. You have someone, and they're both highly educated. You have someone like the thoracic surgeon who says you do not need to do any sort of post-operative treatment. Like, he definitively said that with a lot of confidence. And then you have the chemotherapy doctor saying, oh, no, that's not the way things go, right? And so we erred on the side of caution, but was it the right error for the amount of detrimental health benefits that you suffered afterwards? Would it have been better not to have done that and had a more robust recovery early on? Where and you can't second guess, right? Because you never know what's going to happen anyway, right? But there was a lot of complications with the choice of doing the post-operative targeted therapy because it lowers your immune system. You got sick very often to where we were in the hospital multiple times, probably more than a dozen, for multiple days. And that you just don't get a chance to bounce back from that. Right? I mean, it's hard when you're sick and suffering to come back from that sort of health event, right? Like, it just compounds itself because you never have a chance to recover and come back. And that's really difficult. It's difficult for you, I know. And it's, very disheartening that that's the way that ended up.
But we're slowly making them make
yeah,
them
no,
come
we
back.
are. No, I know, we are.
It's at least we stopped.
We did, which I think, and
And we'll take the consequences. We knew that when we stopped.
Well, you go and you do your scans and they see whatever they see.
We got one coming up.
Yeah, I know, in January. And that's all we can do.
That's all we can do.
And then, we do what we did a couple of weeks ago, which was seek out an alternative and see how that goes, right?
Right.
You always have to keep investigating because things change.
Right.
Right, like in any field, particularly medicine, because of...
Well, I think what's interesting to me, because in this case we have a concierge doctor, and the concierge doctor is not working with health insurance.
Right.
So she has a lot of liberty. She's taken, she's looked at the labs, she's looked at all the exams, she's looked at all the CT scans, and she is making recommendations and doing things differently that the other doctors maybe would have done too, but they are kind of like
I know.
confined because they have to do things according to health insurance because it's supposed to be done a certain way. That's what I'm guessing. But we're dealing with concierge now, which is totally different. Right?
Yeah.
So I'm wondering, even though the things that she's ordering is different. Right?
Which is what we were seeking out.
Right.
Through
So yeah.
the other channels that we...
It's a blessing that we're able to do that,
Yeah. No, I know it is.
With regenerative medicine, that's the only way to go.
Right.
At this stage, that's the only way to go. And if, like you said, if we're lucky enough to get good scans coming up, and we can do another round, then we'll keep going. That's all we can do. But so far, some positive things are happening. So, yeah, it's been a rough ride for both of us.
It's been challenging for sure, and it's different in the respects that some of the other life events we've been through, because you've had other challenges, right? I mean, we both have, but there were goals or time frames in which certain events you could see progress, right? This is different than that. It's an ebb and flow of you make some progress, but then you're in the hospital for 3 days. And then you make your way out of that and you think that you're doing better, and then like around this time last year, you got RSV, right, which is very detrimental, and then you're in the hospital for a week. So, which has to do with a lot of factors of where.
Now, I'm going through all this physically, but how are you taking all this? Every time I'm in the hospital, what's going on with you?
It's difficult to.
Tell me a little bit, because I don't know what you're going through, because I'm the one out and being morphined up. At least I got morphine. What do you got?
Well, it's, part of it is.
What are you dealing with?
Well, there's lots of things, right? Like, you don't want to see someone who you care about suffer, right? Number one, and you want to make sure that whatever plan of care that they're administering is the best for that particular situation, right? Or at least the most positive that can be done with that set of circumstances. And you also have to take a look and see what can really happen. What if nothing improves, right? So, there's a lot of things that.
Were you trying to get all the ducks in a row and make sure everything was the way it's supposed to be?
Well, it's.
Like insurance wise
and keeping up with. That's one component that you have to keep up with, because.
Your FMLA.
Right, that's another
And then
component.
Communicating to your employers.
Right.
Letting them know.
Right.
And at any point were your employers not cooperative
No,
with what was going on?
No, they've always been.
Well, that's good.
Yeah, so that's never been an issue.
Stretch time.
We both. So it's a big part of it. It's a lot to juggle, So, but hopefully we've made it over the hump. I mean, that's, you know what I mean?
Yeah.
That's the main thing is being able to see some progress, and I feel that the last 2 weeks have been a lot better.
I know, since we come back from Florida, it's
Yeah.
been very positive. It's slow.
Right.
It's very, very slow, but you know what? Every time I use the pulmonary function meter,
It's better.
it's a couple of
Points
digits higher
Yeah.
every single time. So I'm like, it's just a couple of digits, but it's better than it was the day I do it every day.
Right.
So it's getting better.
No, it is. But
Is it helping you? Knowing that it's better?
yeah, I mean it.
Because I know recently you just had your FMLA papers turned in.
Yeah, I had to. Yeah. Yeah, no, that's all taken care of. So, if you do happen to have a health event where we have to take some time off, I can certainly do that. We hope that doesn't happen.
No,
again,
of course
right?
not.
But
I'm hoping not this year.
right, but it is that time of the year when the flu and
Right.
all those other.
I'm being very careful. I think I'm gonna start wearing a mask.
Yeah, no,
Only because I do not want to get RSV again.
no, that was really
I
bad.
don't think I'd make it through this time.
It was really bad.
It was bad.
So we want to make sure that at least we're taking all the preventative measures that we can.
Yeah.
So. But let's talk about some of the other aspects of the trip, right? Like you got to see the ocean.
I hadn't seen the ocean in 20 years.
So that was very
That
nice.
was good.
And it was fun. I had a lot of fun
We had
outside.
fun. Then I got to see, which is one of the advantages of having a concierge doctor that was your cohort that you graduated with. It was fun to see her again.
Sure.
Spend time with her. We spent a lot of time together when we were studying together.
Right.
So it was fun to just kick back and not have anything to do but just sit back and just chat
Right.
and eat. We had some fantastic food down there.
We did. It was really wonderful. Gabriel got to go out and enjoy.
Gabriel got to go out and dance and hang
Enjoy-
out with her friends.
Yeah, which is very nice.
And we got to watch the Yankees.
Lose.
Did they lose that night?
They did.
All right.
Yeah, they did, unfortunately.
But we got to spend time together.
Yeah.
Which we don't often get to do.
But with that much time. Like
Yeah.
that.
Just planned out, you and I.
Right.
That was nice.
The drive was fun. We got to see the fall colors change from
Yeah.
here to Florida.
Yeah.
So it was kind of peak for
Yeah.
that, you know. We had fun on the road.
Yeah, we always love going out on the road.
Yeah. No, it was fun.
We got to see some improvements on the road toward Atlanta because we spent many years driving down to Atlanta.
Yeah, they widened it a lot.
Yeah, so we got to
Traded.
see a lot of improvements down there.
We did. It was a lot easier.
Very pretty, too.
Yeah, it was a lot easier to drive through.
So that was fun. We love road trips.
And yeah, I would rather drive than fly
Yeah,
for sure.
yeah.
So.
And the puppy got to ride.
Yeah, puppy got
It
to
was
go.
his first road trip.
Oh, Bubba road
It
trip.
was his first baby's road trip.
And you got to meet a couple of new friends.
Yeah, that didn't go too well.
Well, for one of them. The other two I don't think you cared about. But the other, Bugs was too playful for you, wasn't
It
he?
was too much.
Bugs was a puppy, and you're too old to play puppy games.
Aw.
So, yeah, I know. It would have been different had Bugs been
He's
older.
like saying the video's over.
Bugs.
Thank you so much, John, and Rocky for letting me do my video.
Yeah, you're a superstar. It hasn't been 30 minutes, though, has it?
I don't know.
I bet it's been 15.
Let's see.